We're always looking for a quick solution, for a shortcut, for the next technical fix, when what we actually really need to do is get on top of the virus, get as close to a zero COVID state as possible, and then we wouldn't be looking for the next technological fix. The expansion of blended learning, which is online and in person, has already meant that people are at burnout. The idea that people have a second shift or a third or fourth shift to give throughout the summer when they are exhausted is just not going to happen. Even if it went on longer, a proper financial package of support that made sense and allowed these people to sustain their business, sustain their employees, is actually fundamentally important. You know, if you got ready to open up and had to throw away perishable goods, that has been happening throughout the entire pandemic. There were surgeons, nurses, care workers reusing PPE. There were some examples of hospitals being delivered PPE that was 10 years out of date. That's before we even get towards the care sector. You know, some of the lowest paid, insecurely paid people, literally the ones holding iPads while we had to watch our loved ones in care homes on Zoom, not having access to PPE. The idea we're all took by surprise couldn't possibly accommodate this when that is decades, years and decades of underfunding of our NHS is an insult to anybody who provides any care, who works in that sector or associated industries. And it would be so much nicer if we could just apologise to those people, acknowledge what happened, and not give contracts to our mates who don't even have any experience in providing PPE. That would be a great start.